Good afternoon, everybody, and welcome to this webinar. My name is Marianne Nordström, and I'm a clinical dietitian working in Oslo, in Norway. And I am grateful to welcome you to this webinar organized by the Multidisciplinary Management and Care Working Group on exercise in neuromuscular disorders with the subtitle Overcoming Barriers, Staying Motivated and Making Movement Work. The topic of this webinar was suggested by the patient representatives and were discussed and agreed with the entire group on the last EURO-NMD annual meeting. So this is a topic that we experienced that both patients and professionals would like to hear more about. And today's presenter will be Nicole Voet. She's a rehabilitation doctor and researcher working at the Rehabilitation Center Klimendal in Arnhem and Radboud Medical Center in Nijmegen in the Netherlands. Her research focuses on exercise, pain, and fatigue, as well as mental well-being and organization of care. An overarching theme in her work is patient participation. Dr. Voet is a well-known presenter with great expertise and always interesting to listen to. And as usual, there will be some time for questions and comments after her presentation. And with that, I leave the floor to you, Nicole.
Thank you very much, Marianne. And some years before, I already gave a presentation on this topic, and it's good to notice that the amount of knowledge we have on this topic is increasing very, very rapidly. So I hope you hear news on this topic. Let's first start with the take-home messages, so you know what I will going to present in the next 30 to 40 minutes. First of all, what I always say in every presentation on exercise, start low and go slow. Then, talking about exercise and NMD, but also every single part of care and NMD, one size doesn't fit all. The third one, the context matters. Training is not only training, it's more than just exercise, and therefore I will talk about more than training in this presentation. And the last one, we always say you have to listen to your body, but I will learn you why you have to listen proactively to your body. And my PhD research was about the effect of aerobic exercise in NMD, in FSHD in particular. And my research and research of many other researchers shows that aerobic exercise in patients with NMD is very effective. So we know that, but we know less about strength training in NMD, and we don't always focus on the side effects and adverse effects of exercise. And therefore, in the past years and currently, I focus on also the negative effects of exercise and, of course, how to diminish them, and also strength training in NMD. First of all, side effects are not a problem because most of the time they are temporary and they are mild. It's, for example, muscle soreness, but be aware muscle soreness can be more pronounced and longer in NMD compared to people without NMD and can appear more quickly. It can be increased heart rate, shortness of breath, acute fatigue, and it's very important to be aware as a patient and to educate as a healthcare professional that these can appear, because otherwise patients will be anxious or will be afraid of the side effects, and that's not needed. But you have to be aware that side effects cannot become adverse effects. And when do side effects become adverse effects in NMD? That's when recovery time is not taken into account, when the exercise selection is improper, when the contextual factors, so all the activities in daily life need a lot of energy, or when the exercise intensity is too high. And I will dive into them in the next slides. First of all, this is research from colleagues from the Stanford University. They performed a maximal cycling exercise test in patients with NMD. And the maximal cycling exercise test is the gold standard to measure aerobic capacity in patients and also healthy people. And they used this exercise test also to take a look on recovery time. Because when you perform such an exercise test, you're wearing a mask to measure your aerobic capacity. And people were asked to wear the mask after termination of the test to see how they recover. And it appeared that patients have a longer recovery time, and the recovery is also compromised. So we have to take into account that people with NMD in general need more rest after exercise. And there's another thing. I always say my patients are top sporters in daily life because daily life activities already cost a lot of energy. Walking the stairs or walking, having a job, caring for your family, it takes more energy than for someone who doesn't have a neuromuscular disease. These people on this picture are also top sporters in daily life, cyclists in the Tour de France competition. But there's a difference because these cyclists don't have to drive their own car, they don't have to cook their own dinner, they don't have to make up their own bed. And one of my patients said once, and they win a gold medal, and I do not win anything. So remember what I said before, that the recovery time is prolonged and the amount of recovery is compromised. And in addition to that, daily life is already top sport. So the amount of time for recovery is also compromised. So it's very, very important to not only look at the exercise and the exercise intensity and frequency, but also everything around it, and to have enough time to recover from exercise. And sometimes I say to my patients, for example, when they have young kids, you don't have the time to recover from exercise, and having young kids is already exercise. So sometimes the decision is to not exercise, because otherwise it will lead to overuse and a negative effect. So be aware of daily life activities. Sometimes it's already exercise. As I said before, having kids can be exercise. Lifting your kids, caring for your kids, running around. And I sometimes give the advice to wear a heart rate watch during daily life, or to feel how fatiguing is daily life, is caring for your kids. And then people say, oh, it's already exercise. And then we come to the conclusion that you're already exercising in daily life. And everyone understands that these cyclists in the Tour de France will not exercise in the evening after a competition, then they will rest. So we have to be aware as healthcare professionals that we don't ask our patients to exercise when daily life activities are already exercise. And how can you know? When you perform daily life activities, your heart rate will increase. Not very much, but a bit. And when you exercise, you notice that your breathing rate will increase. So when you are performing activities in daily life, you can see with the heart rate watch, is my heart rate higher? Is it increased? And do I breathe more frequently? Then it can maybe exercise. And the other part is that, for example, standing up from a chair, walking stairs can also be strength training exercise if you feel it in your muscles. But discuss this with your healthcare professional. And if you're a healthcare professional, ask this to your patient, ask for their daily life activities in order to prescribe exercise in the right way. I already told you about the gold standard to measure aerobic capacity and to prescribe aerobic exercises, and that's a maximal cycling exercise test. But there's a disadvantage, because then you will receive the aerobic capacity and the different ventilatory thresholds. So in other words, when does lactate build up in the muscles? But then it's the sum of the mitochondria, the muscles, the heart, and the lungs. And of course, we want to know too what's happening inside the muscles. And therefore, we performed research during a maximal cycling exercise test. So patients were asked to cycle up till an amount of power that they were not able to cycle anymore. And in parallel to that, we applied surface EMG measurements. And with EMG, you can measure the signal which goes from the brain through the spinal cord to the muscles, so the activation of the muscles. And years before, we knew already from research in cyclists that we can measure also thresholds in the EMG signal. And these thresholds were perfectly parallel to the thresholds from the ventilatory threshold. So in other words, the sum for the whole body was the same as what was happening in the muscles. And we were curious what's happening in patients with neuromuscular disease, because then you see a difference from one muscle to the other, because one muscle has a lot of muscle weakness and the other muscle is more stronger. So we performed a maximal cycling exercise test in 32 NMD patients and 24 healthy controls. A maximal cycling exercise test and parallel to that EMG measurements. And we take a look at these thresholds in the EMG signal. And as expected, we saw a difference between patients and people without NMD. And you can see here the results for the two thresholds. On the right-hand side, you can see the result for the second ventilatory threshold or the anaerobic threshold at the end of an exercise. And when the dots are on the line, there's a perfect correlation between the aerobic threshold for the whole body and the muscle threshold for every specific muscle. The black dots are the patients and the white dots are the healthy subjects. And you can see they are more or less on the line, so no big difference between these two groups. But on the left-hand side, for the first ventilatory threshold, there was a difference, a big difference. Because you see that the black dots, the patients, are more on the line and the white dots for the healthy subjects are under the line, below the line. What does it mean? It means that in patients, as expected, muscle fatigue, so the muscle threshold appears relatively earlier in time than the aerobic threshold. Or in other words, as expected, the muscles are fatigued earlier in time than heart and lungs. So then I thought we prescribe exercise to patients according to guidelines for healthy people. And these are based on the white dots, not the black dots. So maybe when patients are, for example, cycling, they are cycling already beyond their muscle fatigue thresholds, which leads to adverse effects, side effects, and in the end, adverse effects. And that's not what we want to. So since then, especially for patients who experience a high level of muscle weakness, especially, of course, when talking about cycling in the leg muscles, I say to them, start low and go slow. Normally, we start at 50 to 60% of the maximum, but now I say start at 30%, because then there's not a lot of muscle fatigue and you can build up slowly. For example, from 30% to 31, 32, up till 40. And that's always better than start at, for example, 50 or 60%. And the intensity is too high, you have muscle fatigue, and you go back to 30. That's not good for your self-confidence. So start low and go slow. And I hope in a couple of years that we show that also the thresholds will increase when exercising, starting low and going slow. And it's not new, because already in ancient times it was known. And also in Asia, it's called Kaizen. And Kaizen is taking small steps. Because there's another advantage. The exercising, changing lifestyle is changing behavior. And your brain doesn't like changing behavior. Your brain likes doing the same things, having the same structure. So when you start to exercise, your brain will prevent you from exercise because it's another behavior. But when you are taking small steps, for example, when you want to increase the muscle strength of your biceps, then start with only one biceps curl 3 times a week. That's doable. And then the week after, 2, and then build up slowly. And because these are very small steps, your brain will not wake up and will not detect it as a behavioral change. And then you have built up to, for example, 3 times a week, 3 times 10 biceps curls. And then your brain thinks, oh, let her go. And you've changed your behavior. So taking small steps is doable and will not be detected as a behavioral change by your brain. So it's also in that way doable. I've promised you that I will tell you more about strength training because in webinars before I focused on aerobic exercise training. And we are still a bit afraid of strength training in neuromuscular disease because it's about the muscles. And we think the muscles are more vulnerable in patients with NMD. But I see a lot of patients in my consulting room who are performing strength training because they like strength training more than aerobic exercise training. And they performed it very successfully. So then we thought, why not ask these patients, how do you perform your strength training? So we can learn from patients instead of the other way around, because they're the gold standard. They perform strength training and have a very positive effect. So what we did, we interviewed patients who performed strength training successfully and also interviewed patients in qualitative research who were not able to perform strength training. And these are the difference. Or in other words, what are important pillars for strength training? What did we learn from patients? The first one is balance. You have to have a good balance in your daily life to perform strength training. When there is a disbalance, for example, your daily life activities are too demanding, then strength training will not be successful. The second point is a sustaining factor. We all know that you have to perform training your whole life if you are able to. Training is not 1 week every year and then the other weeks no training. So a sustaining factor is very important. Look for a strength training activity that you like, a friend who is going with you to the gym, a physical therapist, a coach, etc. You have to do it all year long. Then a very important one, to experience a sense of control. Because you have to experience control on your strength training to experience effect of strength training. And what we saw in these two different groups, the successful group and the unsuccessful group, especially in the unsuccessful group, there were patients who want to have control of their own training scheme, or want to write their own schemes, who want to perform them themselves with good education. And there's a group who want to be guided by a physical therapist or a coach. And when people were unsuccessful in strength training, there was a mismatch. The people who want to have control had a physical therapist who was very strict, and the people who were more uncertain didn't have any guidance at all. So take a look at the patient in front of you, or if you're a patient, be aware to which group do you belong, and match the physical therapist, the coach, the training setting to the control you want to have. Then the fourth one, daily life activities. It's not only about exercise, it's also about healthy food, a good night of sleep, feeling well. So also take care of all these other aspects. And the last one is that it has to be personalized. So when you want to start strength training, be aware, what's the goal of my strength training? What do I want to achieve? And match the strength training to your goal. For example, if you want to have more muscle volume, then you have to perform strength training with less repetitions. But if you want to increase your muscle endurance, you have to perform strength training with a higher number of repetitions. And of course, focus on the right muscles. Very important. Then some words about fatigue, because there are different kinds of fatigue. There is peripheral fatigue inside the muscles and central fatigue in the brain. And several years ago, there was a lot of research on peripheral fatigue, especially also central fatigue in NMD, but not a lot anymore. Although it's increasing, there's an increasing attention nowadays, and it's very important to know the difference. Peripheral fatigue is inside the muscles, and you want peripheral fatigue. And it happens when your muscles are low on energy and build up waste, like lactic acid. And you can notice it during the training. For example, if you are performing biceps curls, then the last repetition is more slowly. And that's a sign of peripheral and muscle fatigue. And you feel a bit of burning and muscle pain, and that's okay, but no longer than 24 hours. And it doesn't have to limit your daily life activities. So that's what you needed, but not too much. And it helps you getting stronger. And we also take a look at peripheral fatigue in our patients who were performing strength training successfully. What we did, we asked them to perform their strength training exercises, in this case, a leg press. So we take a look at the maximum, and then they exercise at 20%, 30%, 40%, 50%, 60%. And with EMG, we take a look at the fatigue threshold. The threshold at which the peripheral fatigue started. And it appeared that all these patients who were successful, while training successful, exercised just above the fatigue threshold, a little bit above the fatigue threshold, or in other words, with a bit of peripheral fatigue in the muscles, but with not a very high level of peripheral fatigue. And you can see it, the line, the EMG measurements is not stable, not horizontal, but a bit increasing. And so we can detect the level, the fatigue threshold. So a little bit of peripheral fatigue is needed. Then central fatigue. Central fatigue is in your brain. And your brain sends weaker signals to your muscles when you're getting tired. And that's what you don't want. And it's causing by a lack of sleep, a stress, a long-lasting effort. It's like your brain is saying, you have to slow down. And when there's a lot of central fatigue, you're not able to have peripheral fatigue and to have an effect of your exercise. So therefore, all these other components in daily life are so important. And when, for example, your daily life activities or the activities of your patients are too demanding, then central fatigue will happen because your brain wants to detect the muscles, especially the weak muscles, for overuse. So what's happening? Central fatigue to your weak muscle, there will be disuse, inactivity, and your brain will increase the amount of activity to your relatively more strong muscle, which leads to overuse. So when there is no good match of exercise intensity or daily life activity intensity to what patients are able to do, then there will be a lot of central fatigue. So disuse and overuse, and that's what you don't want. So it's not the more the better. Another important thing when talking about exercise and preventing adverse effects is compensation. And what I told you before, that the weak muscle is not activated and the strong muscle is more activated, that's compensation. And you can see here people who run a marathon on a video, and you can see they are not able to walk the stairs in a normal way. That's compensation. The brain detects that the calf muscles, like leg muscles, there's a lot of lactate, and the brain wants to protect these muscles from further overuse. So the brain let you move in another way. So you can see compensation in moving in another way. So muscle overuse leads to compensation, leads to a change of movement. And when these people take enough rest, it's no problem. But when patients are compensating a lot, then it will lead to chronic pain. That's what you want to prevent. So also take a look at the way you move in daily life and also during exercise. And the physical therapists have to take a look at how people are performing these exercises. At the left-hand side, you can see a perfect coordination of these athletes. And you can see at the right-hand side, two brothers in a triathlon competition. They move differently. The left-hand brother on the left hand is not very fatigued. The brother on the right hand is fatigued. He's moving backwards. You can see it in his face. So you can see in the way people move that they are fatigued. Often the partner says to me, I can see when my husband or my wife is fatigued. I can see it in the way you move. So ask the partner, the physical therapist, the coach, to be aware of these change of movement to prevent overuse. And also, yeah, of course, we want to detect these compensation mechanisms too. So what we did, we performed again a maximal cycling exercise test, but now with motion analysis. You can see that this man on the bike, he has little balls on his joints, on his body, that are reflective markers, and with that we can detect changes of movement. So when the main muscle starts to get tired, a stronger muscle takes over to help. We can see that the movement begins to change. And after a while, even the helping muscle gets tired. And that we can detect using EMG. And with that, we were able to see the thresholds for muscle fatigue, and we can give patient a kind of a training passport, and we can tell them when you want to cycle, for example, for exercises, you have to cycle with a heart rate of 120 or a power of 100 in order to have a bit of peripheral fatigue, but no compensation, no pain, no overuse. And then we performed the same measurements, but then during walking, because walking is very important for several patients. So we measured with EMG the leg muscles, but also again the kinematics, so the motion analysis. And we asked patients to give a number on a scale from 0 to 10 to their subjective level of fatigue. 0, not tired at all, and 10 during walking, very, very tired. To see what's the correlation between the objective level of fatigue as measured with EMG, the motion analysis, and the subjective level of fatigue. We measured 11 people who walked on a treadmill, during which we measured EMG and motion analysis. And every 2 minutes we asked them, how tired are you now? And what did we discover? We discovered that the objective muscle fatigue already appeared before people detect their own muscle fatigue. And therefore I say, be aware that when we ask patients to listen to their bodies, they are already ahead in time, because they cannot, at least these patients, cannot detect their level of muscle fatigue real time. And be aware there is a kind of bias, because all these 11 patients experience pain and fatigue in daily life. And maybe when we measure the cyclists of the Tour de France, they are able to detect muscle fatigue objectively and subjectively at the same time. Maybe not in competition, because I think that they can diminish the level of fatigue in competition, because then it's not very helpful. And my hypothesis is that because patients want to cope with other people, want to do things in daily life, work, job, family, they ignore the level of fatigue, their feelings of fatigue, and therefore they are not able to detect fatigue in real time anymore. That's my hypothesis. So what we will do in the next month is we will measure children from 16 to young adults, 20 years of age, but also in these age range, people without NMD, to see if there's a difference between the objective and subjective level of fatigue and the timing. Yeah, and the other thing we discovered was the compensation mechanisms. You can see a very difficult slide over here, but what it shows you is that there are a lot of compensation mechanisms for all these 11 people. There was one general compensation mechanism. When people are getting fatigued, there was an increase of ankle dorsiflexion in order to prevent tripping and falling. But all the other compensation mechanisms were different from one person to the other, because not every patient is the same. The level of muscle weakness differs from patient to patient. So there's not one summary of or one compensation mechanisms what is happening during fatigue, during walking. So again, one size doesn't fit all. And a couple of months before, in spring, I gave a presentation on exercise together with Jeno, and Jeno has a congenital myopathy, and he has a lot of experience. He is also a gold standard how to perform exercise in the right way, because he's very successful. Prior to the COVID period, he was able to walk only a couple of 100 meters. During the COVID period, he exercised himself, and he was able to walk 10 kilometers. So he is doing it the right way. And he learned a lot. I learned a lot from him. What I've learned is there's a difference between motivation and discipline, in the way that sometimes people have a lot of motivation, they like exercise. It's a positive thing for them. But sometimes people don't like exercise. And in that case, discipline is needed. And then it's very important to schedule exercises at the same day in a week, with a friend or a physical therapist. And when you're a patient, be aware, do I have a lot of motivation? And if you don't have a lot of motivation, you need discipline. But there's also a side effect of motivation, and that's overuse, because Jeno is also very motivated. So he's always at the upper, he's always a little bit at the threshold, instead of then there is disuse. And what he also said is, I'm an idiot, because people often say he's an idiot because he is exercising a lot. But he's not stupid. He knows what to do. He has a lot of educated himself on exercise and his congenital myopathy. So you may be an idiot and doing strange things, but it has to be healthy and not unhealthy. And what he said about compensation, sometimes it's okay in daily life to sometimes wash your hair, brush your teeth, but not during exercise, because then it's repetitive and it will lead to pain. And of course, use the aids to prevent compensation. And what I said before, understand the specifics of your NMD, something to think about, because Jeno said that he has muscle pain and muscle fatigue for 2 days. And I was a little bit surprised negatively, 2 days of muscle pain, but he said my specific congenital myopathy, it's known that I recover less quickly. So I need these 2 days. And of course, he doesn't schedule an exercise again in these 2 days. So yeah, understand the specifics of your NMD regarding exercise and rest and muscle structure. He also said that training is like trading stocks. He wants to have a high risk and a high reward. It's always connected to each other. If you want to have a high effect, then there's also a high risk of adverse effects and side effects. Or do you want a more cautious approach with smaller risk and gains? And be aware of that. And the last one, a very important one, especially in NMD, but also when you don't have an NMD, compare yourself only to yourself and not to others, unless you're a top sporter. Some last words about aids. A lot of patients are afraid that using aids like arm orthosis, orthosis for the leg, walking aids, make them lazy. But no, it's the other way around. We performed research in boys with Duchenne muscular dystrophy using arm support. The right two upper graphs show you what's happening inside the muscles when boys do not use arm support. They were able to move for only 100 seconds, and the lines are not horizontal, but they show a high level of muscle fatigue. The lower two graphs show what's happening when moving with arm support. Boys were able to move for more than 400 seconds with a low level of muscle fatigue. So in other words, aids help you to exercise and to exercise your muscles. So it's the other way around, when prescribed, of course, properly, in the right way, at the right time. So yeah, what about the future? I showed you that not all patients are able to detect their level of muscle fatigue at the right time. So in other words, they drive in a car without a dashboard. And when you drive in a car without a dashboard, at least in the Netherlands, you are taking off the road. So what we want with our research in the near future is we already are able to perform a kind of a muscular training passport, which you can see on the graphs here. But up till now, it's a bit of an extensive research with the cycling test, EMG, the motion analysis. So we hope that in the near future, we can develop a kind of a muscle watch. I expect a sensor at the trunk to detect muscle fatigue. So you can see in daily life and during exercise when you are at your threshold, when talking about exercise, and when you are before your threshold in daily life. to be safe on the road, safe during exercise, and safe in daily life activities. And so to end, when exercising, start low and go slow to prevent disuse and prevent overuse. One size doesn't fit all. Context matters. Training is more than just exercise. It's also about daily life activities, having enough rest, all the other lifestyle factors. And the last one, listen to your body, but be aware you have to listen proactively to your body. And I'm very curious if there are any questions.
Thank you, Nicole, for an excellent overview. Now it's time and possibilities to send questions. Either you can ask to have questions. You can ask questions yourself by using the raise hand function, and then we will open your possibility to speak. Otherwise, you could write your questions in the chat.
And I already see 2 questions in the Q&A.
Yeah.
I can answer them.
Yes. You want me to read them first, and so you can answer?
Yeah, no, I can see them in front of me. The first question is the goal of exercise primarily cardiovascular, e.g. increased heart rate or muscle strengthening, or a balance between the two? Yeah, there's a question prior to these questions, because we perform exercise with a goal. And of course, the cyclists in the Tour de France perform exercise because they want to win the Tour de France. But most of the time, a patient with NMD perform exercise because they want to decrease fatigue, decrease pain, want to experience more energy, want to experience a higher level of muscular endurance. So the goal of exercise has to fit the goal of exercise in general. So when you want to experience less fatigue, then I would advise cardiovascular exercise. But when you want to climb the stairs more easily, then I would recommend strengthening functional exercises. So it depends on what's the goal, what do you want? And of course, the most ideal way is to perform aerobic exercises 2 to 3 times a week, and in addition to that, strengthening exercises. But it has to fit your daily life, and you have to have enough rest in order to prevent overuse. But it's very important to know what's the goal of the exercise. The second question is, have you considered using mindfulness practice, mindful walking or movement, in order to train more body awareness and body fatigue awareness? Yeah. And I think that's a very good way to increase the body awareness. And also mindfulness can help in taking more rest in daily life. And we advise sometimes mindfulness exercises because they are easily prescribed using your smartphone to people, also to fall asleep in the night or to experience more rest during the day. But when you're able to feel your body and what's happening in your body, it can help you in performing daily life activities and exercise. And it's also part of acceptance and commitment therapy, of which we know from previous research from Christopher Graham and colleagues that it's successful in patients with NMD. So I can recommend it. Yeah. Then the other question, what should you select for when looking for a coach? Yeah, so be aware. Are you someone who wants to prescribe your exercises yourself, or are you someone who wants to have more guidance? And search for a coach or physical therapist with a match. So sometimes you want someone who write your exercise schemes, who are saying you have to do this and that, and sometimes you want to perform it yourself with less regular guidance. But it's good to ask that question before. And of course, there has to be a match in personality. lots of patients doesn't know how to start, what is the best way to tell them. And if one exercise is the best to start, what one should be. Myself, I always recommend stationary bike. What do you think? Yeah, to begin with, which exercise is the best to start? It has to be the exercise which is doable. When talking about strength training exercise, you can only exercise these muscles who are able to move against gravity. So for example, when I cannot lift my arm not further than this, I cannot exercise my arm because then I will immediately compensate, which leads to pain complaints. So only exercise in the movement you are able to do without compensation. So which exercises are doable? Are you able to climb up an ergometer? And then the second one is, what do you like? It's better to perform exercise you like, which is a little bit less effective than exercise which is in theory very effective, but what you don't like, because then you will not perform exercise chronically because you don't like it. So choose something you like. And a stationary bike is great for your muscle strength, of your leg muscles. And it's doable because most of the time you can do it at home, watching Netflix. But when you like swimming more, then maybe swimming is better. So it's very important to do the thing you like. And be aware, start low and go slow. So better to start with only 5 minutes of cycling and then the week after 10 minutes, then already start with 30 minutes. Thoughts about exoskeleton devices to assist exercising. Yeah, I said before that using aids and also exoskeletons can help to move, to be flexible. But of course, exoskeleton are in an innovative phase, are not on the market yet, but maybe in the future it's possible. And sometimes it's asked about what about electrostimulation? That's different because what's about electrostimulation, then you stimulate the muscle, but you bypass the brain. But it's very important to include the brain during movement because the brain is a big control center, which is taking care of you. The brain activates the movement, so you learn how to move, and also the brain prevents you from overuse. And with electrostimulation, you bypass the brain, so there's a risk of overuse and it's less effective because the effect for daily life is diminished. So I don't recommend electrostimulation. What about aqua fitness for patients that have problems with walking and stairs? It's perfect because then there is less gravity, you can move better, but there's one thing you have to be aware of, that it can take a lot of energy to close and unclose for aqua fitness, to go to the swimming pool, to dress and undress, I mean, to go to the swimming pool, and also moving in the water, you don't notice that you are sweating a lot. So sometimes wear a heart rate watch and be aware what's happening in your muscles. So a very good way to exercise, but be aware that it can be very demanding. And it's a bit more difficult to say 5 minutes of aqua fitness and then dress and go home. But you can, for example, start low and go slow by applying rest in between your exercises. What kind of strength training would you advise in general? Which one do you prefer? I think a year before, 2 years before, I would have said strength training with a high number of repetitions and low weight, because we then thought that would be had a lower risk of side effects and adverse effects. But we now know better, at least from previous research. I would now say choose the strength training which fits your goal. When you want to become stronger, then I would say perform 10 repetitions. But when you want to increase your muscular endurance, then I would say indeed 15 to 20 repetitions. because it's not the case that the higher the number of repetitions, the safer. No, because also when you paint the walls of your house, then you can get a lot of muscle pain, and that's less demanding, but also a very high number of repetitions. Every way of strength training can lead to overuse. But the other way around, performing 10 repetitions with the right weight doesn't have to lead to overuse if you're doing it the right way, with the right technique, with the right amount of rest. It's even the other way around, because it's easier to prescribe strength training with 10 repetitions because you know better when you are fatigued or not than prescribing 20 repetitions. Because when you are performing 20 repetitions, the difference between the 18th and the 19th repetition is less. And when performing 10 repetitions, you know better when you are performing it the right way than with 20 repetitions. So maybe it's and even the other way around. So don't be afraid to perform less repetitions, that it's more harmful, and fit the strength training to your goal. There are also some questions in the chat. Strength training in DMD. There is less experience, and we have to be aware that especially the capacity of the DMD muscle to rebuild after exercise is limited. So we have to be more aware. But yeah, we have to also be aware that daily life activities, moving arms and legs, it's already strength training. So it's not the case that boys and adults with DMD are not strength training at all. They are strength training in daily life already. So again, I think that when we are careful and when we start strength training early, and of course we have to take a look at the age of the child, then it can be helpful for daily life. But we also have to be aware that daily life activities for DMD can already be top sport. Lifting your arm, moving your wheelchair. So it is possible, but we have to be aware about rest and daily life activities as top sport. Let's see. I think I've answered all the questions. And it's also, oh, we're in time, I see. Are there any more questions for now?
I wondered if you could elaborate a little bit on the longer recovery time that you mentioned early in your presentation. And how much longer is it in general? And is there a difference between aerobic and versus strength training, or is it more based on the intensity of the exercise?
Yeah, we don't know exactly, but my hypothesis is that it differs from person to person. And of course, during these maximal cycling exercise tests, they only measure the recovery for several minutes, not for the whole day or the day after. But it was significant. It was a lot of minutes longer, and they didn't recover to baseline level, a lot of patients. And I think it depends on the type of muscle disease. As Jeno learned me before, congenital myopathy, also Duchenne muscular dystrophy, the capacity of the muscle to recover from exercise is limited and diminished. So that can maybe a factor causing the increased time for recovery. But also we know from a lot of from top sporters, and also top sporters who have a lot of central fatigue because of daily life stress, or they have the flu, they also have a longer time for recovery. And so that's, and of course the amount of muscle weakness on the one hand, and on the other hand the exercise intensity. We all understand that when we are running a marathon, we need more recovery than when we are running our weekly 10 kilometers. So it depends on a lot of factors. And We are up to now not very well able to measure recovery and to measure the point of time at which we can start exercise again. I discussed this with a researcher who is specialized in top sport. And the only factor which was significantly correlated to recovery and to the way that people exercise was the subjective feeling, but that was in healthy people. So we know that in NMD patients, the subjective feeling is not always correlating very well with the objective feeling and the activity itself. For example, when people are jumping and they are jumping less high, then that's a factor of fatigue and a limited recovery time. So we can use that for patients, for example, to ask if you are doing your daily life activities or exercises, are you still able to perform the same amount of repetitions? Are you still able to walk to the supermarket? And if people are not able to do that anymore, we have to be aware. That's a warning signal. For example, I had a patient who wasn't able to perform her exercises anymore, and I was looking at her exercises and I was thinking, what's going wrong? I do not understand. Her muscle strength wasn't different from before. And then she said to me, I have another job and it's more demanding. And then I thought, oh, Nicole, listen to yourself. It's the context which matters. So then we decided to diminish the exercise intensity because the context is different. She has another job. And when a couple of months later, she increased the exercise intensity again when her job was less demanding. So there's a lot of similarity between exercise in top sport and exercise in NMD. And in my opinion, the main difference is in the recovery time and the time needed for recovery. And my hypothesis is that the subjective bodily feeling also differs from patients to top sporters, but the patients who I see in my consulting room who are performing strength training and aerobic exercise training very well, these are the patients who do have a very, very well bodily feeling. So when you're able to feel the feelings of your body, the signals of your body very well, and also detect it and cope with it and listen to it and change activity exercises when needed, and then it's the most successful.
Well, thank you. Thank you for this excellent webinar and for also sharing your knowledge on all the questions raised by the participants. And I think we will just round up this webinar and give you a warm applause. And I've seen some hearts on the screen, sending all our love for this to you, Nicole, for this webinar. Thank you.
Thank you very much. And if you have any questions, I'm also very happy to help answer them because I learn a lot of questions. So thank you very much and have a nice weekend.
Thank you, Nicole. Thank you, Marianne. See you. Bye.